All right, we'll go ahead and get started then. Thank you everybody for joining us. So this is the Mental Health Colorado Disentangling Mental Health and Criminal Justice presentation series. My name is Adam Goss. I'm a project manager with Mental Health Colorado. Thank you again for taking time out of your Thursday to learn a little bit about efforts across the state to disentangle mental health and criminal justice. So today, we're going to have a presentation from the Integrated Insight Therapy Impact Team out of Delta County, I believe. And we have Joel Watts and Amy Thurston. And I'll just go ahead and kick it over to you guys. Thank you.
I appreciate that, Adam. Let me first introduce Amy Thurston. Amy Thurston is a new addition to our team. On the other hand, she has been there from the very beginning as a district attorney. So as we started Impact, she was part of the original, I think she was part of the original pre-trial committee that this kind of evolved from, or along those lines. And so now Amy is actually working with us as part of our engagement, community engagement. We haven't quite settled on the name yet for public safety or something like that, but it'll cover our impact for both men, women, and some other programs we have in my head to try to disentangle community criminal justice type stuff, right? So I don't know if Ed Hagen will join us. He may. Our house manager is actually on vacation, and there's no way to force him into this. I tried, but he threatened me, so that's fine. Impact started in January of last year. We had two of our first males. They both successfully completed the program. We now have what we consider pre-competency and competency inside the home. We have seen one who completely absconded and one who had to go back because it was just such a disruption in the house, along with some severe violations of the program. My goal is not to have anybody sit in jail for a month waiting on competency that may come a year from now, right? So we are working on all of that, all those moving pieces, and being very mindful that not only do we have an obligation to our client, but we have an obligation to our community as well in the court system, who is putting the trust in us to restore these clients. Right now, it is in Delta County. Absolutely. We have two houses. We have men and women. However, we have from Delta County, Montrose County, San Miguel, and Montezuma County clients. So we have expanded past Delta County, and we are open to anyone from across the state who has a certain level, I think it's tier 2, who needs that outpatient restoration. We are open to that locally. We are open to people who are what we would consider pre-competency, severe mental health. Do we do the competency? Do we not do the competency? How about we put them in this house, give them 30 days, and try to stabilize with medication, outpatients, peer case management. We take care of all their basic needs. We don't ask them to contribute anything to the house money-wise. If they want chocolate cookies, that's probably something a little bit different. And if they can pay for it, they can pay for it. Smokes, cigarettes are, we've actually had lots of discussions about cigarettes that you would simply not believe. Do we buy them? Do we not buy them? Do we let them smoke? Believe it or not, the science says, yes, you let them smoke for a couple of reasons. If they're trying to quit substances, you don't want them to quit everything at once. Quitting cigarettes, failing and relapsing to cigarettes is a short relapse to everything else. But the other thing is that smoking cigarettes actually helps with decreasing symptoms of schizophrenia. So since we have so much of that going into our homes, we will buy cigarettes. If they don't have the money, we will buy cigarettes. Plus, it just keeps everybody nicer and calmer. So I do better with questions. So if you have any questions, please feel free to shoot them at me.
Just off the top of my head, off that, Joel, are you guys a marijuana-free facility, full substance-free for participants?
We are, and part of that, Adam, is that there is something about making sure everything works with their medication. We're talking about people who are on bond, and sometimes those bonds include a couple of thou shalt nots. I personally have no or little issue with marijuana, but in the home, when you're talking about people who have a variety of different additional bond requirements or other, we have just cut out mood altering substances, except for cigarettes and mellow or Mountain Dew. So as we're discussing those questions, or formulating those questions, what we usually do is we appear in court and we start to advocate for the client. Our county court here is amazing. Judge Zerb has been absolutely an ally in getting this program off the ground. And so we talk about it. We're very open in court about what's going on with our clients. And we have already interviewed the clients, or especially if it's in Delta County, we probably know the history of the client. And we're the one going to a public defender going, please let us have a chance on this instead of releasing them or putting them in jail. There should be another variety of options between those two, especially people with persistent mental illness. And so when we get them, if they're already in jail, we usually get it about a day or so for us to make sure they're ready to go. We get them, we bring them to the house. We try not to throw everything at them at once, but we do take them shopping. So we take them shopping, get some food, get some socks, underwear, whatever their basic needs are. We get that. And there's been sometimes we take them right from jail and go get them coloring books. Whatever it helps to stabilize them inside the home, because the first goal is to stabilize them inside the home, then get into treatment. Treatment comes later. And so we then a couple of days to a week, we get them inside of our outpatient facility for mental health or substance use or both, as well as scheduled with our psychiatric provider. When we add primary care here in a couple of months, we'll be able to do primary care, psychiatric care, and mental and behavioral health. And then we start looking at the other special requirements that they may have. We have a client in there now that has, clearly undiagnosed autism. And so, when I look at this, I go, this explains 90% of his charges, right? I understand that. So let's get him specially diagnosed with community options. Let's get him on that track, because our goal is to plan for discharge, not discharge back to the jail, not discharge back to DOC, probation, whatever else. It really is, how do we take this opportunity to get them the help that they need and are able to use and function in society? So we start that long process or short process on some of them, and we start working on that to make sure that they are getting all the help they need. Usually they're averaging about 10 to 12 hours of therapy, and that are outpatient services, which includes psychiatric, QMAP, peer, case management, and group work, as well as individual work. And so we're seeing the successes that we're seeing are people who have been, one guy was in Pueblo 4 times.
RJ?
Peaches.
Yep.
Four times or so over the last couple of years. He was in our program since last year, just got his place to live, is getting his welder's card, is getting a job, this is the longest that he's been stable and clean. And you see him walking around town and it's great. People love it. We have one guy who was chronically homeless for 10 years. And that was a big battle to overcome, because the moment he started to feel secure, that's when he would act out. And we need that leeway of understanding what a purposed violation is versus what a mental health violation is inside of our program. And so we do understand that. So after about he was in jail waiting competency restoration or to go across the mountain for 250 days, I think. We got him out. He was able to be restored. Now he's going to be one of our peers. He has reconnected with his daughter. He actually knows who he is. For the longest time, he had a DID. He got his birth certificate, social security card, and ID for the first time in 10 years. And as a mental health professional, I wish this was this easy for everybody. But the moment that he saw his name in print, all of those nice personalities that he had and was struggling with and would battle with simply disappeared. He knew who he was. He was able to get a job. He participates in our program. And like I said, he's also connected back to his young daughter. And this is again, most stable that he's been in years. And so that's what we see. We see that long-term progression out of persistent mental illness into something that I think that they're able to now go and give back to the community. Yeah, sure.
I'm gonna give Joel a break from talking for a minute if there's no questions for him pending. So as he mentioned, I was a prosecutor in Delta. I was here for 2 years about in county court. And from the criminal justice side of this, what we were seeing, especially after COVID hit, I mean, everybody knows that we have massive problems with state resources, resources across the state for mental health. Everybody knows, right, on at least cerebrally, there's this concept out there that we have people who are being jailed for mental illness. And that's kind of that's the hot topic clickbait kind of headline there, right? So seeing it on the ground is infuriating. It's not just you're not being jailed because you're sick, but what do you do with somebody when there's no room in the state hospital for a tier 2 legally non-competent to proceed individual who goes out and because of their illness consistently commits crimes? You've got a community who's pissed. You've got an individual who's not an imminent violent danger, but could be. And you have a jail. And you have jail deputies who are not prepared for what happens when you have those individuals in the jail because the judge doesn't know what to do. They can't go to, they're not getting into Pueblo. There's nowhere for them to go. There are no secured facilities. There's no help. And we're talking about legal competency. We're not talking about, personal competency. We're not wards of the state. We can't progress with their cases. So they have cases pending. They shouldn't have cases pending. They should have help. I was able to jump on an internet sort of webinar thing with on competency. And one of the senior judges on this webinar was talking, and he was like, and I've never seen out of custody competency restoration happen ever in my life. And I'm like, I've seen it. Before that, never. Before this, never.
We've actually had it 4 or 5 times now, I think. 4 or 5, maybe even 6 times outpatient restoration for some really persistently mentally ill individuals. And so part of that also is that we go from facing probation or maybe more jail time to now, because they're doing so well, they can throw them into diversion.
Yeah.
And so going into that is a big plus, again, for our legal system, and to take that stress of the collateral consequences off. Yes, so yes, actually we do. So Adam asked, are you having success supporting participants with getting employment? And what does daily engagement look like? So 2 questions, I guess. Supporting participants, yes, we are actually we have a VOC rehab specialist here. And so we do life skills, we do MRT for some, we do all that stuff to get them ready, because the goal is not to get them ready to go back to jail or to get them ready to go back to court. It's to get them ready to go live on their own, free, clean, sober, and managing their life like they need to. So we have that all built into the entire program of, you will get a job. This is what we may look like. So the other one is what does daily engagement look like? Adam, I guess what you mean by that is therapy or peers. We actually cover the house 24/7. And so they always have a peer, maybe 2 peers, maybe a case manager, maybe a therapist is stopping in. They're also here. They get to come here. They get to our outpatient office. Clearly, you don't know where I'm at, but here in our outpatient office. But the houses are about 2 blocks away, so they're able to come here. We also try to, for some of them, depends on their charges and their level of progress, mobility in 30 days. So most of them are on pretrial. They have to wear a GPS monitor for the first 30 days or so. We want them stabilized because we're getting people who have been long time unstable or destabilized, I guess is a better way of saying it. So we try to get them stabilized, get them used to the rules. Then we start to invest in mobility. So we have one person in there who is in there for some pretty grievous things because on his meth and his schizophrenia, he was not doing good things, but now he's able to, he's getting a job, he's working every day, he's riding a bike to where he needs to, so he goes to Celebrate Recovery and some other things, and he is taking control of his treatment and his life as he gets ready to decide to move on. Do you pursue involuntary medications from the court? I don't. We don't really have that need right now. Part of that is it's a voluntary entry into the program. If you're going to go into the program, you have to agree to follow the rules of the program, which includes treatment. If we recommend treatment, which includes medication or otherwise, you have to be willing to take that. My hope is, as well, is that unless it's something severe like schizophrenia or whatever else, therapy kicks in and you're able to divest yourself from a lifelong need of medication. We've only had one individual refuse participation in the program, but my concern is his mental state, as it is anyway, probably could not get him into the program and keep him stable, unfortunately. But part of that is we don't really need the involuntary medications from the court, because when we go there, we go, you'll have to take your medications, because most of them already have prescribed medications as part of this program. If you'd like to get off of those medications, you'll have a reevaluation. We'll have that step down process. And again, it all depends on a case-by-case basis. We have to have enough grade to operate this program. And thankfully, the courts and the participants continue to do that. I think
Lynn,
Jenny
had
had her hand up.
Yeah, hi. My name is Jenny. I actually live in Montrose County, so this is really great to hear. I work for CDHS in the Office of Civil and Forensic Mental Health and project manager. I had a question similar to Lynn. Like, do you find it difficult to find a bed for all of your clients, or do you feel like you have a lot of open beds at any given time? Are you the only provider who does this work out here? Questions just about your capacity to be this provider.
We are, as far as I know, and Ed Hagens has joined as well. He's our director of community engagement. As far as I know, we're the only provider doing something like this. I think there's a day type reporting out on the Front Range in El Paso County. I want to support all the programs equally. I find that in this instance, our day reporting program for these clients who are persistently severely mentally ill simply would not work, because we have a community of chronically homeless individuals that are not as supportive of sobriety as I would like to think. I'll put it
We
that
have
way.
an enormous meth problem.
Yes, that's it. Amy's cut to the chase. So we are right now for our men's home at capacity, but we do have a few people that are about to move on. Plus, we are developing traditional transitional housing very, very, very soon. We hope. We have a grant. It's called the 2.01 grant that HCPF developed for transitions. And as part of that process, they gave us a large amount of money that we can build for a house. They just didn't tell us how to get that large amount of money. So we are working on getting that type of money to be able to go and buy these other homes for transitional and for step down. That will actually ease the bed situation, because what we're finding is that people who are completing the program, some will immediately move on, but some of them don't. And there's just no way for me to go and say, we've supported you for 6 months, here's the door, good luck. Because recovery takes a lot longer than that for some individuals. And some individuals, they're ready to go after 3 months. They've completed their outpatient restoration. Second evaluation says you're done. You're now on diversion or probation. And they're ready to go because they have a home, they're ready. But not all individuals are like that. So right now we're at capacity, and rarely are we at capacity.
Joel, can I piggyback on that?
Yes, sir.
In response to the previous question, I think, when you look at the service array that we're endeavoring to create in the region, you have things like a sort of community treatment that are oftentimes your community-based supports, daily check-ins with case managers, peers, access to a therapist, and certainly a med management regimen. The nice thing about impact and success is that for those patients that historically might be in an ACT program and even fail out of assertive community treatment because they need a residential level of care, that's where I think success kind of shores up that gap. The other piece in there that Joel's referencing, I think, with transitional housing also is going to close the gaps further. And as communities, we also need to be looking to our cities and counties around permanent supported housing so that we complete that circle of care that many of our homeless, mentally ill, substance using clientele might need from time to time.
So yes, to that other question, we do have funding coming from grants. We also have funding for treatment from Medicaid. We have grant funding that covers all of the lived experience expenses, right? So we do use that. For those who don't have Medicaid, we also have this other treatment type grant for high intensity clients, and these are sometimes high intensity clients, I will say that. As far as releasing the model, I am more than happy to give you the manual to talk about any group, to any facility, to anyone, anytime. I will tell you, it takes a village. It takes a village because law enforcement has to be notified, law enforcement has to be informed, and they have to be on board. You have to have peers, at least 2 house managers, and then you have to have the treatment team ready to do this. I think that part of the success is that we do have a lot of these services right here that we can provide to our clients immediately. But I'm more than happy to release the manual, and I know that Ed has thankfully started to do all of this nice inclusion, exclusion, and get some of these other policies and procedures kind of codified. Amy's helping with more of that criminal justice piece, or the legal piece, I should say. And so we're going to continue to do that and offer as much as we can to where we can, whether it's in Delta County or other counties in the state. But I am more than happy to share everything that we have as to how this program has gotten off the ground and what we're doing. One of the things is I want to give a shout out to Axis. Axis does the outpatient restoration. We thought about bringing that in-house, but I love the idea of having a third party provide accountability to our individuals and to let us know that if we're doing a good job or not. And the clients are becoming restored, and that's a good thing.
Myers huge.
I will definitely email you the link. Also, let me tell you what we've done in Delta County as well, is that we actually have a impact docket on the second Tuesday of every month, just for the clients who are from Delta County. I will definitely email you the info, and if there's a time that we need to talk, I'm more than happy to come to Larimer County and talk about what we need to do. I'm more than happy. I really like this program. It's working well. There's always things to make better and within the program. And it's great to see when clients who have struggled in this community and is widely known as someone who is waiting for the next time they go to jail, to be seen walking down the street with a cup of coffee, talking to people because they're on their way to a job.
Can I anecdote a little bit just as a closure to kind of explain the vast difference? I don't know how many people we have here involved in law enforcement. I know me and Ed, basically. That individual that Joel was talking about who's getting his welder's license. So as a prosecutor, I was privy to a lot of stuff, right? I would hear stories, I could watch security cams. I went and sat with my court deputies one day because they were talking about what's going on. This guy was in jail because every time he left, he would commit a crime. He had violently assaulted an officer, and I think he did so on purpose to be in jail at one point. He was pacing to the point that I wasn't sure if his feet were gonna bleed. He wouldn't stop. It was like watching a caged wild animal. He decompensated so fast and so severely. He would not remain on meds because he was convinced that they were dangerous by someone, I think. It was very off and on. He couldn't talk hardly, couldn't meet your eyes. Has been a fixture in this community, actually. Is very well known by most community members. And now he's going on to become somebody that he used to be, that he wanted to be.
And this is the same guy who was so bad off or so destabilized that he lost fingers to cold and meth, right? So this is a guy who also, and I know this may not sound like a big thing, but it's a big thing to the rest of the house because they do all the cooking. And so they do meal planning, they do recipes, and everybody in the house is kind of expected to participate. And this guy loves his mom, loves her food, and brings a recipe book and starts for the first time cooking those recipes. And he will not deviate from those recipes because that's mom's cookbook. And then suddenly about 3 months ago, he says, I think I can make this better, and then starts experimenting. And I know that doesn't sound like a big thing sometimes, but here's a guy who just 2 years ago was in the hospital losing fingers, losing toes, having to go to Pueblo 4th or 5th time. And now he's out there cooking for a bunch of ne'er-do-wells in our community and going, I can make this better than mom's. And to me, that's just part of the story of impact.
That is amazing. Does anybody else have any questions for Joel, Amy, or Ed?
Can you go over your referral process again? I know you mentioned it a little bit at the beginning, just how clients come to you.
So right now, we're kind of revamping some of our referral process. Right now, a lot of it comes from Bridges officially. If it's in Delta County, it definitely comes through our jail-based behavioral services. And so we have the jail contract here in Delta County. So we're able to do a self-referral because we know people in Delta County, but otherwise it's coming through our Bridges liaison or through attorneys who are hearing about the program or through BHA. We have, various different people who are hearing about the program going, I need to send you this. Okay, so send me the person, the charges, maybe some history about them, medication stability, stuff like that. And so we are defining more of that, especially as we branch out past Delta County.
Got it. Thanks.
All right, well, if there's nothing else further, Joel, would it be all right if I would share your email address with anybody that reaches out in interest?
Absolutely. Share my email address, my phone number, whatever it is that you need.
Alrighty, thank you. All right, well, thank you so much, Impact Team, Joel, Amy, and Ed. We really appreciate it. You're really doing some amazing work over on the Western Slope. That's awesome. Really excited for the future for you guys, and tons of respect for what you all do. So I'll go ahead and wrap things up then. Thank you everybody for joining on your Thursday afternoon. We'll be here again, same time, same place next month, Thursday at 11:30. So have a good rest of your Thursday. Appreciate it.
Thanks.
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 Take care.